Sure. So thank you everyone for joining. We're really happy to have you here. Um, and we wanted to welcome everyone to the resident panel portion of our VIR MASH series. We also wanted to remind you guys that we do have another event with the PD panel on December 18th. So make sure to join for that one as well. So for today, we have five awesome residents from all over VIR top programs with Mount Sinai, USF, Kaiser, Rush, and MCW. Yeah, Shreya, do you want to take it from here?
Yeah, sure. So the session's mostly geared towards MS4s who are kind of like in the process of applying and interviewing right now, but also MS3s, 2s, 1s who are just trying to get familiar with the process. I'm going to touch on sort of how all of the residents got interested in IR, sort of their journeys, their application cycles, any advice that they might have in terms of choosing programs and just general advice. So with that, I'll just have all of you guys, all the speakers who are here so far, just go ahead and introduce yourself briefly and give us like a quick, like 1 minute spiel about your path to VIR.
Yeah, I guess I can start. I'm Alex. Hello, everyone. Thanks for putting this together. Thanks for having me. I was born in Central Asia and then lived most of my childhood and young adulthood in Russia. So, and moved to the U.S. when I was 18 to Florida. That was quite a transition, Russia to Florida. I went to college there and then moved to Ohio. I guess I craved some snow or some cold or something for med school, and then Milwaukee for residency. I um I feel like sort of end of the undergrad is really the time to kind of start figuring out the specialty. I mean, obviously, assuming that you're going in the medical field. But I saw a cardiologist put a percutaneous valve, and I just couldn't help myself. It was just so cool. I thought I'm going to be a cardiologist, and then I don't know. I met Prak Patel and fell in love with him and just had to, come and learn from him. So that was my very simplistic path to VIR. Yeah.
That's a great story, Alex. I didn't know you grew up in Russia. That's pretty cool. All right, I'll go next. So my name is Subash. I'm a PGY2 at Rush VIR. I grew up in rural Kentucky, went to medical school at George Washington in DC. By the way, I'm in a public area. Can you guys hear me okay? Okay. So my path to IR started pretty early on in medical school. I went to one of the organization fairs where, we got a taste of all the different specialties, and like Alex, I was just fascinated by endovascular procedures. And I had been exposed to surgery, and I knew that I wanted to do something procedural with my hands. I wanted to make an impact on patients, but I hated the way surgery really had such a long recovery time and such a major side effects and risks. So endovascular procedures really grabbed my interest. Um, Early on, I knew I wanted to practice clinical medicine, and I wanted to be involved in longitudinal care, similar to how a cardiologist or a vascular surgeon practice. I got discouraged when I saw that a lot of IRs were not practicing that way. But then I started attending some Zoom talks just like this one, and I learned that there's very different flavors of IR. And before long, I ran into Zaim's mentor, Dr. Vatican Cherry, and he kind of introduced me to the gospel of clinical VIR. And I learned that there's lots of programs out there that practice with this philosophy. So I quickly became very passionate about clinical VIR, and I kind of just ran with it. And I think a lot of you guys are probably in the same boat as well.
All right. My name is Zaim. I'm a current PGY6 at Kaiser in LA. I've worked with a lot of you guys, especially Sue Bosch, pretty closely when he was here. Um, I was born and raised in New Jersey, on the East Coast. Um, Initially went into medical school at Robert Wood Johnson over in New Jersey. knowing I want to do something operative. I want to work with my hands. I went into medicine to specifically for the reason of not wanting a desk job. So I wanted something fast paced, running around, just like in it. And so I knew I wanted to do something surgical. What it was, I didn't know. Until, a friend of mine, when I was a first year medical student, she was a fourth year, and she was like, "Oh, you should just check out the interventional radiology department. I think you'd like it." So I went downstairs. I saw, they were percutaneously putting in a basket and pulling out biliary stones in one case, then emboing the liver in another case, ablating the lung in another case, all things that I had never heard of before. And I was like, "Oh my God, I can't believe you can do all of this in one day." And it can be one person doing all of these surgeries all over the body. So that's what initially got me interested. Kind of like Subash, what I didn't like was the fact that when I was on my rotation, there wasn't much not longitudinal follow-up. I would be like, "Hey, you want me to round on these patients the next day?" And they'd be like, you don't really need to. Like, we already did our case, and now it's all up to the medicine team." And so, that was one reason I was not really as interested in the specialty. But again, just like Subash, I met Dr. Vatican Cherry just like cold messaging him on the SIR Connect forums, and he's so available for med students. Like, he's probably a good significant reason many of you are here. He took like an hour and a half on a Sunday to just call me and tell me about clinical VIR and was like, "Hey, you should just come rotate with us." During fourth year, I did my rotation here. It was the hardest rotation of all of medical school, but the most rewarding. I learned more in that 1 month than, like, 4 or 5 months elsewhere. I was like, I have to train here for residency. There's no other option. So I ended up staying, loving it, and I've been here ever since.
And then Omid, did you also want to introduce yourself?
Yeah, sure. Hey guys, I'm Omid Jazieri. I'm a PGY6 at University of South Florida. So same class as Zaim. Actually met him and friends till this day from the interview trail. Also a Visla alum. Similar story in terms of the kind of come up to IR as Zaim. I actually didn't even know what IR was in until like middle of third year or first half of third year, and ended up shadowing it. And there's like so many people get the light bulb moment, and just been hooked ever since. And it's just grew. And most importantly was through med school was the Kaiser rotation definitely got me even more hooked. But yeah, so.
That's awesome. Thank you all for sharing. I think it's really inspiring to see other people's pathways to VIR. And although everyone has a unique path, I think we can all relate to some aspect of what you all shared. So yeah, thank you for taking the time to share that. I guess for our next question, I know that we have residents from different like postgraduate years and different levels. And so I wanted to ask, how did you kind of navigate choosing a residency program? What kind of factors are important or were important to you in choosing your specific programs?
Yes, and start again. And I kind of alluded to how I chose my program already a little bit, but I think it's very important, especially for procedural training, is to kind of look into what's done. Um, Now with that's probably one of the, especially for some of the um, first year, second year medical students, that's one of the parts that IR kind of tries to find its definition, because there is a fair amount of variability between institutions. Um, we're fortunate enough to do virtually all endovascular work, but that doesn't have to be the case. And arguably, that's not the absolute prerequisite. That's not a requirement, to do carotid stents to be a good IR. But I think it's a requirement to have some responsive faculty and program directors. So I think that personally, that's probably paramount for me because someone is doing carotid stents in that hospital. And if your program director is willing to reach out to that person and set up some elective, let's say if you're interested, or send you away to some other place. So I think people is always by far the most important thing, supportive faculty, supportive program directors, and then sort of kind of the procedural layouts. What's the relationship between endovascular specialists in that hospital? What's the relationship between vascular surgeons, cardiologists, neurointerventionalists, neurosurgeons, orthopedic surgeons? And then, yeah, I would say those were probably the most highlighted portions for me. And obviously there are 10 million other factors, but people and training environment. Yeah.
That was a great answer. So before I get into my factors, I think like one thing that needs to be said, don't be afraid to work hard. You have a very short amount of time to learn IR. There's only 2 fellow years, and you have to learn so much, and you want to be as prepared as you can for once you're out there by yourself. So don't be afraid to go to a program that works hard and gives you as much exposure as possible. The factors that were most important to me were high case complexity. I wanted to be able to do PAD. I wanted to be exposed to aortas. Most programs are doing IO. Most programs are doing some type of embolization, whether it's UFI or PAE, things like that. So high case complexity, clinical model of practice where there's a robust clinic. Residents rotate through that clinic. They see the patient, and that clinic should be a way to kind of generate referrals for complex cases. And then third, something that was really important to me was a great culture, place where, like Alex was saying, the attendings are have good relationships with residents, and there's some sense of community, because you're going to be there for 6 years. You want to be happy somewhere that is a comfortable balance between someplace that makes you feel supported, but also pushes you to learn and be your best. So those are my 3 factors.
Yeah, so for me, the biggest factor for me was like just the clinical side, because I think there's a lot of heterogeneity in training in our field. You have some big academic centers where you're doing purely IO and then the kind of quote unquote bread and butter IR, where you're doing kind of biopsies, venous access, drainage, gastrostomy tubes, stuff like that. And it's important to know when you're in your shoes. This is something I didn't quite understand when I was a medical student, but now that I'm on the other side, I think it's very wise to recognize as a medical student is that IO and those bread and butter cases you'll get everywhere. And the thing that differentiates programs is whether they're building into fields where there's competition with other specialties. That'll give you an idea of how aggressive they are and how politically savvy they are. And that's the programs that are doing those cases, say like treating BPH, treating fibroids, treating vascular disease, where there's multiple other players and other shareholders. Those are the programs that will teach you how to be successful as a physician because they're able to hold their own. If you're at a program just doing purely IO and bread and butter cases that other specialties don't really want to do, then you may not get that skill set where you can fight to build things that you want to build in your career, and you may get pigeonholed into doing like a 50-50 job where you're reading between small cases. And for some people that go into this field, that's what they want, and that's fine. But as a medical student, you should really think about what kind of practice you would want 6 years down the line when you're in attending. I know it's hard to have that kind of foresight now, but are you going into this field to do a little bit of procedural stuff and know how to read imaging well? Or do you want to do big cases and have longitudinal clinical follow-up and, be more of a surgical person where that's kind of the direction you want to go to? And one thing I would advocate for is just seeing what programs recent graduates are doing. Not just academic versus private practice, but are they doing 100% VIR? Are they doing 50-50 as part of a DR group? Are they working in a community hospital? What is that program training their graduates to do? So those are a couple things now that I'm a six that I think that you should be looking into. In addition to everything, Subhash and Alex already said, obviously the culture is important, location's important. But these are just some things where you can get a little bit of foresight into what they'll train you to be able to do.
Yeah, I mean, I'll pretty much echo what everyone else was saying. And things I'll add, I mean, obviously location for a lot of people's a priority. I think what Zaim was saying in terms of deciding what you want is a big deal. Because, I think not every practice and not everyone's the same in IR. I mean, that's just the reality. It's a heterogeneous field. There's a lot of different styles of training. So kind of decide what you want. And even, to be frank, I think some of that will even go into like, if you like kind of what he was saying in terms of you want to do some procedures, you want to read as well, um, even DR is a good option for that. I mean, you could do a lot of procedures in DR, and I'm not trying to like dissuade anyone, but it's like okay to be honest with yourself and be open. So that's like just like no shame in that. Big thing, like he said, is the clinical practice, because I think that's where IR is heading. That's kind of where we need to be. How aggressive they are, just like what everyone else was saying. Case mix. I think some objective things you can look at. I think that are usually pretty good indicators of a good program. That, in addition to what Zaim was saying, with getting into other fields. Um, Biggest thing is I would say, some of the other big things at level one trauma, is it a busy transplant center? Are they doing PAD? Are they doing aorta, endoleak stuff? These are some of the objective things in addition to what Zaim was saying that indicate, if you the kind of program they are, if they're like more aggressive program. Um, but yeah, I think number one thing I tell like every med student that comes through here is just what do you want? Like decide what you want. What do you think you're going to want? And because I mean, programs are different. I mean, in general, it's combined with DR too. So you have to keep that in mind. You have your very academic places, you have your hybrid, you have your community programs, and they all offer different things. And like a very academic place would not be good necessarily a good fit for someone who wants to do like a hybrid, like who wants to go like a community program and vice versa with, someone who's very academic going to a community program might not be a good fit. So these are like other things to consider, but there's just kind of like general considerations for just, any program, really any specialty. So yeah, that's pretty much echoing what everyone else has to say.
One thing I'll add on quickly, and there's some good discussions going on in the chat. Shoot, that thought just left my mind. Give me a second, it's going to come back.
All good. I'll go ahead and move on to the next question, but feel free to chime in if you remember your thoughts, Subhash. So we were
Okay, it came back to me. It came back to me.
Go for it. Go for it.
So I was just thinking about what Zaim was saying, and I think he mentioned something about knowing how to build a clinical practice. And in this society in particular, WCVIS, I'm going to guess that there's a lot of you out there who have been exposed to this concept of clinical IR, and maybe some of you who have interest in jobs that are majority IR or 100% VIR with longitudinal follow-up. So if that's something that you are passionate about, you need to be aware that the current job market, there are not that many job opportunities that are just out there online waiting to hire people. But that doesn't mean those jobs don't exist and cannot exist. If that's something that you want to pursue, you have to be willing to build that kind of practice on your own. You have to want to learn how to develop those referral streams for yourself, because nobody's just going to hand that to you. So that is another criteria that you can use to assess programs. Some programs emphasize teaching people how to build clinical practices. So like we had a lecture on that this morning, for example. So if that's something you're looking for, definitely ask about it on the interview trail and see what they can do.
Awesome, thanks. Kind of segueing into this concept of like clinical VIR training. I'm going to specifically direct this question towards Omid and Zaim, since you guys are nearing the end of your training programs and have probably seen more of this. What kind of advice would you give to people on the interview trail right now in terms of like questions they should ask to gauge whether a program is going to offer strong clinical training? So maybe touching on things like how integrated VIR clinic is into the program, how many ICU rotations they have, things of that nature.
Yeah, I could go first. I think one key thing is, if a program is admitting their own patients to their own service, I think that is, a basic thing that is very heterogeneous. I think it's probably the majority of programs that actually don't admit patients to their own service because they're scared of having a patient under their care. So a lot of VIR programs, like they'll just have all their patients admitted to medicine because they don't know how to manage someone on the floors, which I don't know about you guys, but I think that's like kind of a basic skill as any physician. You should be able to admit a patient to a floor and have them taken care of. Like, it's really not that hard. You're restarting their home medications, managing their diet, checking their labs. If they're diabetic, you can manage insulin. It's something every physician should be able to do. Like, you guys, even as fourth year medical students, can do some of that stuff. So that's kind of a basic skill. And a lot of programs are scared of doing that, or they don't want to do it. And if a person doesn't want to be able to take care of a patient on the floor in the hospital, then they may not be the most clinical program. Another thing to ask is, do you get protected clinic time, or is it just something that's like, oh, you spend some time in clinic when you're on rotation, it's nothing organized. I fully understand that our program here at Kaiser is on one end of the spectrum. So, like, for example, we have clinic half a day a week through every single week of your residency, whether you're on DR or interventional. I understand that not all programs have that, and we're on one end of the spectrum, but at least having some protected clinic time where you don't have any other responsibilities other than clinic, I think that's important. And you know, being involved in the VIR department, even when you're off rotation, I think is also very important. So, um, programs that have VIR conference, even when you're on DR, you can go to conference and spend time with the VIR department. It's not just like, oh, you're on DR for 3 years and then you're on interventional for the last two, so that you can gain clinical knowledge during all 5 years rather than hemorrhaging clinical knowledge over those 3 DR heavy years and then trying hard to learn it back in the last two. That's very inefficient.
Yeah, the admitting thing is huge. That actually drew me here when they said they're one of the highest admitters of in the hospital by volume. So that's definitely a good question to ask. You can just straight up ask when you're on IR, like Zane was saying, how many days of clinic do we have? Is it like a half day a week? Is it a whole day a week? Is it like every other week, or is it they just say whenever you can, which kind of in between the lines um, means it's not that organized. And I mean, the other thing too, you can ask about electives and if they allow you to do electives like neuro or, some places don't do PAD, but they send you somewhere that does, which I think is valuable. And then asking about kind of the interactions, and you have to be kind of careful because it can be kind of an accusatory question, but asking about how their interactions or how their relationships are with other specialties, in particular vascular surgery, and it gives you an idea of how aggressive they are um, and kind of the mindset of the program.
Yeah, thank you both for sharing. We're also gonna have, I think, if you all the other residents, if you guys have more insight to share, please in the chat if you can. I'm going to move on more towards like applications and such. So this question is more directed towards Subash, Alex, and it's basically kind of what qualities, characteristics you guys feel make a successful VIR applicant have been like gone through it recently relatively to others.
The question is what qualities you're looking for in an applicant?
Yeah, what makes
Sure,
a
sure.
VIR applicant?
Sure, sure. So I think some of the most important qualities are curiosity, eagerness to learn more. Whenever we get medical students, they come from a lot of different levels of experience. Some students have already had 2 or 3 rotations under their belt. For some, it may be their first rotation. And you just have to keep in mind at the end of the day, we all know you're a medical student. Like, you haven't been a resident for X many years. So I don't think there's like a standard level of knowledge we expect when you walk in, but just be eager to learn, be passionate about IR. And when you're interviewing and when people are ranking you, another really important factor is how much have you really thought about this field? How much experience do you have? Clinical experience, experience through societies like this one, SIR, etc. Because the worst thing that we could do would be to rank you highly, even if you have great stats, great scores, great number of publications, but you don't actually know what the field is. And then you get so many years down training, and then you're like, oh, wait, I actually want to do DR. And then you leave empty a valuable spot. So be able to speak about your exposure to the field and how much research you've done into it, and try to have a clear vision for what kind of job you want at the end of training.
Yeah, I wholeheartedly agree with Subash. I think there's a sort of a set of how to be a good blank, and regardless of specialty that you're applying, that would be true. So I think, teachable, team player, caring for patients, good, whatever, foundational clinical knowledge, etc. So all that obviously applies. But yeah, I think familiarity with specialties extra, I would emphasize extra hard just because additionally, there's always an opportunity to, focus on diagnostic training. Let me just put it this way, just because of the training model, right? There's diagnostic training is built in, and it's once in a while it happens where some of the IR colleagues decide to switch to diagnostic and vice versa. But I think that is one of the ongoing fears in the APD-IR is like the switching thing. I think people are just getting very focused on that. So um, and then at the same time, that is also not just for a successful match. I think that is very important to um, sort of be honest to yourself, because if you realize that it's not something that you want to do, 6 years down the line, then it's 6 years. That's a lot of time. So I think familiarity with the specialty would probably be the more important one, and that kind of gets a little bit easier with more away rotations and signals and stuff like that. And then the whole other package of, teachable, good person. And then, and ultimately, it's can we see your face for 6 years every day and not get sick of you? I think that's like, if that answer to that question is no, then it's hard to rank that. I feel like it'd be difficult to rank that person. Yeah.
Perfect. Thanks for all that advice. And then kind of on the flip side of that, what are some like common pitfalls that medical students should avoid when preparing their applications? And for this one, I'll have Saim and Amin answer just to kind of keep it balanced. But Subhash and Alex, feel free to answer in the chat as
Yeah, I think a big pitfall is like not having enough experience with the field. I think it's okay to find VIR kind of late. That's totally fine, but you need to know what you're getting yourself into. So, there are some times where, I've interviewed people being, a chief resident at this program, and it's like, some people will go through medical school and just like find it super late, but also not have much experience with it. And it's more the idea of the specialty that they're in love with than actually having experience with it. And so, you should have some meaningful experience, right? And that's not just quantity, it's also quality, right? Like 3 VIR months where you're just back tabling for 8 hours and going home is probably not enough. Like you need to have good experience where you're actually seeing patients in clinic, helping make clinical decisions, or at least presenting to and attending about the patient. Being at a busy program where you're balancing between seeing patients on the floor, operating for 10, 12 hours, because that's becoming a very normal reality for an interventional physician. And like doing some projects where you're involved in some kind of organization. It doesn't need to be SIR, but like you need to have networked with people in the field and like met people in some fashion and presented something, right? um it doesn't need to be like you have 20 published papers in JVIR, but you need to have taken some of your personal time to do something that you were passionate about with regards to interventional. Like that's what I want to see. And that shows me that you're actually putting in some of your own time because this is actually what you think you want to do for the rest of your life. Like I think that's like a bare minimum that everyone should at least have.
Yeah, I think another pitfall is not enough networking. I think IR is a pretty small field. So going to conferences and getting to meet people, getting to know people just dramatically increases your chances of interviews and matching at certain places and getting aways or understanding kind of the landscape of IR. Just because we've both said it, it's a very heterogeneous field, so you have to kind of know what's out there and know who you are and know what it is. I think those are the biggest things. And yeah, I think people, or for whatever reason, I like don't network well that I've seen for a lot of people at least. So that's probably the biggest one. I mean, everything else, like he's saying, like everyone else was saying, is just not knowing the field is can be a red flag for some people if you just don't really, you know, if you're in an interview and you're not really describing what IR really is, because you don't really know what it really is, which I've seen a few times. Um, just sounded cool and people apply. So that's definitely another pitfall, I think.
Every single specialty in medicine has good and bad. There's no perfect specialty. IR is no exception. We have good and we have ugly. And you just have to know both sides and you have to choose it knowing both sides.
Another thing I was going to say too is just kind of with the landscape of IR and DR. And IR, there's less spots, and there's also ESIR and independent. And I'm not really sure what's going to happen with that in the future. I don't know if anyone really knows the trajectory. But another thing, like you could fall into that I think is good practical advice is I would highly consider a DR, and this is might be controversial, but I don't know if I think it's makes sense and it's reasonable. I would consider a good DR program at a place that has good IR versus a place that maybe you don't want to go for that's an integrated that maybe you're not a good fit for, or for whatever reason, you don't think the program fits your goals. I would consider an IR and doing ES, or I would consider DR and doing ESIR somewhere, because like that's just such a viable option now. I mean, maybe there's something I don't know about the future of independent and ESIR, but I think that's um, as of now, and probably when you guys are going to be going through, it's still going to be there. So I think that's still going to hold true.
Yeah, and echo that. I think that's a great point. There are one place comes to mind where you can only do a fellowship or independent IR, and that is Miami Vascular. So if instead of Park Patel, you love, Barry Katzen or other Miami Vascular people, then the only way to train with them will be through the independent pathway, which is, I wholeheartedly agree. I think it's a very viable pathway. In fact, might be even more advantageous in certain instances where you get to train. Let's say there is some internationally recognized faculty in one space, in one institution, and another internationally recognized faculty in the same subspecialty of IR in another institution, you get a chance to train with both and learn from both, and etc.
Awesome. I think you guys touched on really insightful, again, pitfalls that we might fall into just because we don't have the experience, we didn't apply before, and just kind of going into it. Speaking more into kind of relating to what you guys were saying, what advice would you give for navigating virtual interviews and kind of making a strong impression in those interviews? I know that some of you might have had to do in-person interviews, and I feel like we all know how much more advantage you have with that, but we were specifically wondering about the virtual interviews. Yeah. And let's see. I don't know whoever wants to go and answer that. We can take answers from like two, and then the rest of you, if you'd like to contribute with the in the chat so that we can ask more questions. Thank you.
I guess I'll start. I think personally the way it felt is that you kind of get a groove of certain predetermined questions that you kind of I almost felt like I automatically regurgitated the answers to those. And then I think the main portion is just to have a good time with your interviewer and just to talk about your genuine interests. And I'm not sure how, obviously, I haven't applied to other specialties. I'm not sure how their interviews work. If I don't know if neurosurgeons just dig you on neuroanatomy your entire interview, but I would say majority of the time of the entire sort of like one-on-one interview time that I've spent during my application cycle was talking about my hobbies, which I'm not sure. I've heard that section has been gone and then it's brought back or something. But yeah, I think sort of there's like I just said, there's a predetermined set of questions, what's your best strength, weakness, all that blah blah, which usually you kind of get a hang of by the time you do a few, and then you kind of tailor that to the reaction of the interviewer, right? You see if do they seem to like it, do they seem to not like it, did you seem to like it, etc. And then the remainder of it is that, are you an interesting person? Are you a, you know, sociable individual? Are you, will you fit here culture-wise, etc. So I think that was the part of the online interviews that that personally stood out. And then in regard to in-person interviews, I can't speak to that. I mean, I did med school interviews in person, and it was heavily not even financially limiting. I think, I mean, there's Uncle Sam can give us however much we want student loan wise. It's more of a time, like my fourth year medical school, I think some schools are a little bit more lax, but there's no way I'd be able to get as much time off as, for whatever 30 interviews or whatever. And we are kind of unique in that regard because we have to apply first years, prelim years, we have to apply diagnostic programs oftentimes, and then interventional programs. So then we have sort of a triple amount of interviews, and that really limits. Now, I think I would highly recommend actually visiting in person places that you are thinking about committing to for 6 years. But I think this online interview allows you to do a very efficient, cost-effective way to interview all over the country.
Yeah, so in terms of how you can impress the interviewers on the interview trail, it's pretty much the same. It's the same exact thing, whether you did this virtually or in person. They're going to ask you the same questions. Every program is going to ask you why IR, why this program, can you see yourself living in the city? So that's like most of your interviews regardless. For the program, they already know a lot about you. It's all written on your application, and your letters speak to what kind of person you are and what kind of work ethic you have. So really what they're trying to suss out is, are you, like Alex said, are you like a normal person? Are you like a reasonable personality that we can sit in a room with for several years? That's really what the purpose is. The disadvantages for virtual, you don't get a sense of what the culture is like. Is that the culture is like over there? And you don't know what the facilities look like. And they're gonna make any place, no matter how ugly the city or how how not great the department is, anything can look good on a PowerPoint. Okay, so make sure you go, if it's a program you're seriously considering, make sure you go the extra yard, talk to trainees there, talk to other people who have been on the interview trail in the past, just crowdsource some opinions. And like Alex said, if this is a program you are very serious about, make sure you go there in person if possible. It could be an away rotation. It could be for a second look event. Preferably, it's not that late in the process, but you could just informally email them and say, hey, can I visit? Can I just come for a couple days, see what it's like over there? Um, if you can make the time. That's my advice.
Great. And then kind of adding on to discussion about how to choose a good program and specific things to look for. Omid and Zaim, could you guys touch on one, like what role mentorship sort of played in selecting a program, sort of how you assess that, as well as how receptive your program has been to implementing feedback that you've maybe given them to either increase like the amount of clinic time that you get or things like that. And again, how you can assess that while you're on the interview trail and trying to pick the best fit for you.
I mean, for me, mentorship was everything because I went to the program where my mentor was. So, for me, I had that personal connection to my program director. Um, I actually, you know, this was a little bit risky when I was an interviewee, but there were a couple programs where like, there was one little thing that they weren't doing. And I would ask them, hey, are there opportunities for me to kind of build up my experience in whatever that is? Say, if it wasn't a trauma center, are there experiences where I can get trauma experience like at an outside facility or whatever? And like, sometimes I would get frank answers like, oh, if you would like that, maybe this isn't the right place to come. And other programs would be like, oh, of course, we could supplement your education with outside experiences so you're more well-rounded. So like it was pretty easy for me to tell who would respond to my feedback and who wouldn't. From that respect, it was kind of surprising how blunt people were when I asked. Um, but I would say, like, you could always ask, have there been any recent changes or like, has there been a time where you wanted something changed and they were able to take action on it or things like that. Um, the good programs will constantly be evolving because our field is constantly evolving. That's one of the special things about our field. So, um, you know, if a resident has feedback and they think that there's something that can make the program genuinely better, there shouldn't be too many hurdles in getting that done. If your program director is on board, right? But if it's kind of a big powerhouse and there's a lot of bureaucracy and a lot of red tape and a lot of paperwork and all that, you may come up with an idea and it may not be implemented until you're already graduated. So it's just something to keep in mind, and you can always ask about these things. Um, but just do it in a very respectful way and, navigating that like EQ is a lot of the interview process, right? Knowing how to ask things in a polite way and in a delicate way where it doesn't come off as if you're like, oh, your program isn't providing something that's good enough for me. I need to go elsewhere. Like you need to word things tastefully. But that's how I approached it. I don't know if that's the right way, but it worked for me.
Yeah, I think that's a good way. I mean, it's like you said, it's a little risky because it kind of can come off as um, you guys may not be good enough for me or something. But it's definitely, I think it's going to be pretty apparent to you, given like by their enthusiasm and their energy, what they how they feel about feedback. So that, and then you can ask either the residents or, every interview is going to end with what questions do you have for me? So that could be a question, like, oh, example of what has changed, or example of, give me an example of that someone providing feedback that invoked change in your program. So, and you can also kind of gauge by saying like any and changes you guys anticipate in the next few years, and that just kind of gives you an idea of if they're changing or not, which usually is a good sign if they are kind of evolving and moving and growing. The other thing in terms of mentorship, again, I think it's just networking. I mean, going to conferences. I know it's expensive and it's kind of a privilege for people, so I definitely don't think you need to, but if you can, even if it's like a local conference or national conference, just getting out there and I think the future of IR is going to be like what we make of it, what you make of it. So it's kind of like you got to be aggressive with networking, with everything. You just gotta, that's just kind of what IR is going to. So, no one's like, I mean, there are people that will help you, but you have to help yourself. So just like Saim was saying, like how I met Vatican Cherry, I just went up to him at SIR as a third year and like introduced myself and shook his hand and started talking, and that was it. And I did that with like a lot of people. So, no reason you can't do that. And then you have mentors from there, and then you ask them about programs you interviewed at, and they can help you out. So and then likely the people you meet at these conferences, you're going to interview with them. So it's just like, and at that point they may be your mentors. So that's another thing I'll reiterate is networking.
Yeah, I think we all know how like VIR and the IR community too is very kind of close-knit community, and everyone knows each other, and networking is really important. So for our next question, we wanted to know what do you wish you had known about the field, the VIR, or the application process or the residency program that you're at, that you wish you had known before. And I'm supposed to tell two people to answer, but um, I guess whoever wants to go to answer, then go ahead, please.
I think Subash had a really good point of the job market and a really good point that every field has its pros and cons. And I think something that I want to reiterate is just knowing yourself and knowing what you want. Because if you want that, which I think a lot of us do now, this like aggressive clinical 100% IR practice, you're going to have to build it. And I think you need to know that going in. It's like kind of it may disillusion some people about it, but it's there and it's definitely there for the taking, and there are definitely jobs out there, but there's not. I mean, Zaim and I are looking for jobs now, and it's not like every job is perfect in a perfect location that has like 100% clinical IR, and that's fine. I mean, it's just it hasn't the market hasn't caught up to where the trainees are, which is in some ways a good thing because there's an opportunity to build it like how we want it. But just know that going in, it's like I don't think it should change I don't think it should change like what specialty you go into. And I think IR is the best specialty, but it's like you have to keep that in mind. Like, ortho, they have things on a platter. Everyone like they kind of, I mean, they still have to work for their patients, but it's like it's a little bit less and it's a little more, the jobs are more homogenous. IR is heterogeneous in the jobs, and it's up to us to change that. But I think just knowing that going in is important. Also, again, like not to not to like belittle DR, but like if you're like open to DR and open to doing like minor procedures, like that's DR is a viable option too. I think IR people, and I know Vatican Cherry thinks this too. Dr. Vatican Cherry thinks this exact same way as I do about this. But if you're wanting to do 50-50, I think DR is definitely a good option too. So those are things I would say like it's good to keep in mind when deciding what field to go into, and especially when deciding to go into IR.
I don't think this has anything to do with the question that you asked, but one thought that just came to my mind is when you go on the interview trail, and I assume a lot of you guys are M4s currently applying, you're gonna get interviews at some really fancy name programs, and there's gonna be a lot of temptation, and you're gonna have this conversation in your head where you say, "Oh man, like here are the factors I really like in a program, but this would just sound so good on my biography, or like when I'm advertising to patients, or when I'm bragging about my merits, this would sound so good." Don't be tempted. Um, Prioritize quality of training, prioritize the procedures you're being exposed to, the clinical exposure. Because remember, this is training to go out there into your first job so that you can go be a good doctor. Patients are going to come to you not because you trained at X place, but because you have great outcomes, because you know what you're doing. So just keep that in mind.
Great. And then just to kind of wrap things up, would love to hear one kind of overarching piece of advice that each of you guys would give, either whether that relates to like resources that you think would be helpful for students or organizations to join, just tips on like mentorship, networking, things of that sort. It's just one quick piece of advice from each of you guys.
Yeah, I think meetings is a great way. I think given that it's very easy to connect online via SIR Connect, sorry about that, or other other means. I think meetings can be there's a financial and a time commitment component, but there are plenty of the trainee scholarship opportunities which are very manageable. You get to networking, you get to meet, and I think we're just so fortunate with having some of the leaders in our field like Dr. V. Like I cannot thank him enough. Like this whole thing is because of him, and he is just such a tremendous mentor. I was a first year medical student. I emailed him and he called me like 20 minutes later on my cell phone and spent like with some first year medical student who doesn't know what life is, and he dedicated 30 minutes to an hour of his life to show me the way and lead me to light. And we were fortunate enough to have, maybe not Dr. V is probably the prime example. He is just extraordinary, but there are people like him in our field that are available regardless of what institution you're going to. And they want trainees to connect with them. They want to mentor people. And I think finding those is just very crucial, regardless, you know, which place, what practice, etc. you end up being. Just finding those via aforementioned, whether that's your own institution faculty, whether that's meetings, whether that's social networking, etc.
My big piece of advice would just be to be honest with yourself and kind of figure out what you want in life. Um, like, if you're going into this field because you want to do cool cases without having the quote unquote burden of seeing patients or rounding on the floors, and you want to be a good imager as well and be good at reading studies like CTs and MRIs, like I think DR is probably the better way to go. I think, 6 years ago when I was going into this field, IR was kind of billed as surgery light, and I think that is like the biggest fallacy I've ever heard, like coming like 6 years later. Right, like everyone knows those community hospitals where, IR works 8 to 5 and then they're unavailable after hours. Like that happens, that's rampant. But I think we're going away from that very quickly across the board. This is becoming a very busy specialty, and I come to the hospital earlier than some of my surgery colleagues, and I leave later. Like that's the direction we're heading. And so, if you're looking for a quote unquote surgery light field, I would say the future of the specialty is not that. Um, and if you are interested in more of a lifestyle specialty, that's totally fine. Everyone has different things that are important to them. Um, and, everyone's values are different, right? So, if you don't want this to take up a majority of your time and you want to have more of an 8 to 5 and have, more family time and all that stuff, consider DR. Consider that as, a very respectable field where you're doing important work and you have more work-life balance. But be honest with yourself on what you want. Like, don't force yourself into something that you won't be happy with long term. That would be my biggest piece of advice for everyone going into this field. Just kind of know what you're getting into and what's important to you.
Yeah, again, echoing Zane. Just knowing who you are, what you want, I think is gonna be the most valuable thing. I know it's cliche. Um, I think also just like keep them like you're all here for a reason. You'll know you want to do IR. At least you're interested in it, and think of why and like write that down. You can use it in your personal statement and then go back to it because I think it draws all of us. I mean, I really do think it's the best field. But it's one of those things that you get more out of it the more you put into it. So I really think it's really rewarding if you go at it from the right perspective. Um, like he's saying, it's busy. It's not like I don't, I wouldn't call it a lifestyle field, but I mean, you still can have a life outside of it. I think you still can have hobbies and all that stuff. So not to like say you can't, but it definitely, I mean, I'm here later than surgery people quite a, like most times in the week. Um, but it's like I wouldn't change anything. I wouldn't choose anything else. I think it's still. I even like it more as a PGY 6 than I did as a MS3 or MS4 applying. So I really wouldn't choose it. But um, you know, that's me. Everyone's different, and you know, do some reflection. And if it's the right thing for you, just go for it. Like balls to the wall, get into it. And it's one of those things. Like it's just it's proportionally more you put in, the more you get out of it. So that's all I would say.
These guys said it all. I'll keep it brief because I have to go soon. But stay passionate, stay creative. This field is as awesome as you make it. Like Omid said, um, don't be afraid to go out there and create whatever kind of job you want. Go create the referral streams that you want. And you guys are very lucky to be involved in this society and to have mentorship from people like Dr. Vatican Cherry. He's really telling you guys the truth. He's telling you everything as it is. Everything that he ever taught me as a medical student still rings true. Now that I'm a couple years in. So you're lucky to have some good advice there.
Thanks so much for all that advice and just overall for all of your time over the past hour. We know your all of your schedules are very busy, but this was a great discussion on just things to look out for, things to focus on, common pitfalls to avoid, looking beyond residency, kind of things to think about. So yeah, this was awesome. Kind of like Ashley mentioned in the chat, just again wanted to plug that 2 weeks from today on December 18th, we have a program director panel. So please feel free to register for that to hear from some awesome program directors. And then we'll also be sending out an email with contact information for all the speakers today. Once again, thanks all of you guys. Subash just had to drop out, but thanks Subash, Alex, Saeem, and Omid for your time.